While COVID-19 has undoubtedly affected everyone's lives, individuals from marginalized or disadvantaged groups who already experience poor outcomes in healthcare have been disproportionately affected by the current pandemic. Many of the issues that already disproportionately affect the LGBTQIA+ community have led to an increased risk for not only contracting COVID-19, but exacerbating its negative impacts. First, there are several factors which may make LGBTQIA+ individuals more at risk of contracting COVID-19. LGBTQIA+ individuals are more likely to have chronic health conditions, such as cardiovascular disease, asthma, cancer, and HIV. Lesbian and bisexual women are more likely than heterosexual women to be overweight or obese. There is also emerging research about higher rates of prediabetes and diabetes among LGBTQIA+ youth, which could lead to diabetes later in life. LGBT individuals are also around 50% more likely to smoke and vape than their heterosexual counterparts. All of these conditions and risk behaviors could increase the vulnerability of LGBTQIA+ individuals if they are exposed to COVID-19. LGBTQIA+ older adults also experience higher rates of disability than heterosexual cisgender elders. LGBTQIA+ older adults already experience higher rates of social isolation than straight and cisgender age peers. Social isolation has increased exponentially over the past few weeks as individuals have engaged in social distancing. This isolation may exacerbate underlying mental health issues, such as suicidal ideation and substance use. Secondly, a number of the wider inequalities faced by these communities may lead to poorer outcomes in overall health. Because of discrimination, many LGBTQIA+ individuals don't access routine preventative health care and may be less likely to access a COVID-19 test. Also, many trans individuals have had to put off life-saving trans-related medication, procedures, or surgery due to these procedures being canceled or postponed. Transgender individuals experience psychological distress at a rate 8 times higher than the U.S. population and have an attempted suicide rate that is nearly 9 times higher than the U.S. population, with 40% of transgender individuals having attempted suicide at least once. Despite these increased mental health risks, there are a limited number of therapists who specialize in working with people who are transgender, non-binary, intersex, or queer, and there are even fewer providers who are affordable and easily accessible, especially during the pandemic. Some LGBTQIA+ individuals are having to shelter in place with non-supportive family members, which increases the risk of both verbal and physical assault. Finally, LGBTQIA+ individuals may be more likely to work in the food service, restaurant, and entertainment sectors. Many of these businesses have suddenly closed, which could exacerbate pre-existing economic vulnerability for LGBTQIA+ individuals. So with all of those things in mind, here are some self-care tips and resources for individuals within the LGBTQIA+ community. First, stay virtually connected to social support systems. Technology today makes it easier than ever before to stay connected with our loved ones, even if we can't physically be together. Apps like Zoom, Skype, WhatsApp, and FaceTime can help us maintain our social connections and help us feel less isolated. Many local LGBTQIA support groups have also gone virtual at this time, having meetings either once weekly or once a month, so researching and connecting with these groups could also be very helpful. Second, seek assistance and support through LGBTQIA+ hotlines. The Trevor Project provides crisis intervention and suicide prevention to LGBTQIA+ teens and young adults. The Trans Lifeline is a helpline dedicated to the well-being of trans people. It's staffed by transgender individuals for transgender individuals. The GLBT Hotline is a national LGBT help center that offers support to LGBTQIA+ individuals of all ages through helplines, support chats, and counseling resources. Seek out therapy services if you need them from a therapist who is LGBTQIA+ affirming. Try and get referrals from friends or talk to your local LGBTQIA+ support group and see if they have a list of referrals available. Use this time to engage in self-care. Catch up on your reading, teach yourself a new skill, and don't forget to exercise. Start a new project that you may have been procrastinating. Finally, remember to be gentle with yourself. It's normal to feel anxious about the future and grieve the things that may be missing from your life right now or the events you are looking forward to. Allow yourself to feel sad, anxious, and frustrated. Eventually this will pass, but for right now, taking each day as it comes may be all you can do, and that's okay.